Thank you, Professor Kim. And good morning and good afternoon, everyone. And I'm Dr. Ren, and I'll follow Professor Amy's talk and go continue to talk about the evaluation of the impact of the COVID-19 pandemic. And I will use the colorectal cancer screening for example. So as we know, we already know that colorectal cancer screening is the most effective strategy to prevent the incidence and mortality of colorectal cancer. But during the COVID-19 pandemic, the organized screening in the Japan, Singapore, and New Zealand has been paused for a period. So here we want to evaluate the impact of the COVID-19 pandemic on the population-based cancer screening. So here we propose a framework to assess the impact of COVID-19. And in this model, there are many factors affecting the whole process during the pandemic. For example, the outbreak of the COVID-19 will affect the medical capacity and then further influence the screening policy. For example, if the pandemic is severe, then the screening program might be paused or delayed for a period. So in the screening process, the screening rate and the referral rate might be declined. So in the end, the colorectal cancer might progress to late stage and then affect the effectiveness of the screening. So we based on this model and will do the following evaluation. Here we propose 4 different delay schedules to compare with the regular screening and assess how the delay schedule affect the incidence and also the mortality of colorectal cancer. And the first schedule is a delay of half an year. And the second one is a delay of 1 year. And the third one is a delay 1.5 years. And the last one is a delay around 2 years. So here are the results of stage shifting and also the long-term outcomes. And the first figure shows the stage distribution of colorectal cancer by state, by different delay screening schedule and also different referral rate. So here we can see that as the referral rate increased from 20% to 80%, then the proportion of early cancer can increase around 1% to 3%. And also we can find that when the delay schedule is shortened, then also the proportion of early cancer can also increase. And from the second figure, we evaluate the effect of delay schedule on the advanced cancer stage of colorectal cancer and also the mortality. And here we also see that when the delay schedule becomes longer, then the risk of the advanced cancer and the mortality also increase as well. And we also apply this model to the oral cancer screening. And we can see that in the 2019, before the COVID-19, and the screening rate was 27% in Taiwan, and the referral rate was 81%. But during the pandemic period, the screening rate declined to 17%. And also in 2021, it decreased to 15%. And also the referral rate reduced around 8 to 9%. So from this figure, we can see during the pre-COVID period in 2019, there was 28 29% advanced oral cancer incidence reduction, and 17% oral cancer mortality reduction. But during the COVID-19 period, it reduced by 4 to 5%. So based on this model, we can not only apply to colorectal cancer, but also to oral cancer. And next, I'll illustrate 4 different severity of pandemic by using the social distancing index, then apply to the delayed screening schedule. And this index, we considers the total case recovery and also the days of COVID-19 to capture the balance between COVID-19 outbreak and the medical capacity, so that it can reflect the available medical capacity and the ability to accommodate screening service. So the first example is showing the most severe pandemic countries, and their social distancing index is greater than 1. That means their medical capacity is very tight. So the screening program should be suspended. And the second one is the social distancing index range from 0.7 to 1. That means their medical capacity might be not such tight. So the screening program can pause 1.5 years, then restart it again. And then the third and fourth example show that the delay time can be shortened as the social distancing index declines. And from this figure, we already know that the risk of colorectal cancer is associated with feet concentration. So we combine the social distancing index and also these risk profile parameters to provide the screening organizers to decide who should be prioritized to take colonoscopy exam when they were detected as the feet positive cases during the COVID-19 pandemic. For example, when the social distancing index is high, then we only provide those who have highest fit value to take colonoscopy exam. But if the social distancing is low, then we can provide colonoscopy exam to all positive cases, but still prioritize them from the high concentration to the low concentration. So here we, based on this principle and apply to our nationwide colorectal cancer screening program. And we show the estimated number of colorectal cancer being undiagnosed in those big positive cases, but have not underwent colonoscopy this year because it caused by a 3-month pause of screening service due to a large-scale community outbreak in Taiwan during this May and August. So we based on the PPV in 2020, we estimate that for those who had the whose fecal hemoglobin concentration higher than 150, then there maybe have the 433 missed case, and which is still higher than other 3 groups. So this can provide the evidence to show that the prioritizing colonoscopy for those who had higher fit value would be more efficient to identify colorectal cancer cases and securing the effectiveness of the screening program. So here I'll give my conclusion from my talk. So as we know, there are many series of factors affecting the effectiveness of cancer screening during the pandemic, from the severity of the COVID-19 outbreak and to the screening policy, screening process, and then till to the disease progression. So from my topic, we know the longer the screening schedule being delayed, then the higher the risk of the advanced incidence and mortality of the colorectal cancer. So based on this topic, we know if we can prioritize the colonoscopy based on this fecal hemoglobin concentration, then that will be an efficient way to identify the colorectal cancer cases and also secure the effectiveness of the screening program. Thank you.